Hello, this is your week 5 review. First, we're going to go over some of the more frequently missed questions from exam 1. Then we'll go over week 5 homework and talk a little bit about exam 2 that's coming up. So in terms of some of the missed questions from exam 1, some areas that you might want to remediate or focus on are the different adrenergic receptors, so alpha 1, alpha 2, beta 1, beta 2, and what each of those receptors do when they're engaged. So alpha 1, beta 2 sort of had similar SNS fight or flight reactions when stimulated. The alpha 2 receptors are not like the others. So you'd have to recognize an alpha 2 agonist as being different from the other types of adrenergic agonists because it's going to have a different response in the body because alpha 2 receptors promote vasodilation and decrease blood pressure. And clonidine was your selective alpha 2 adrenergic agonist that you had to be familiar with. So if you knew clonidine and you knew the classification as an alpha 2 agonist, an alpha 2 adrenergic agonist, then you should have been able to deduce that it would indeed decrease blood pressure. And we're looking at the beta 1, beta 2 receptors. Beta 1, you have one heart. Beta 2, you have two lungs, was our main focus there. So when the beta 1 receptors are engaged, we see increased heart rate, increased BP. Beta 2, we think lungs. We got the bronchodilation and improved oxygen reaching our lungs. But what you also have to know is what else is going on. So if I'm taking a beta 2, what else might I be looking for? So you need to know these other consequences of the beta 2 receptor being engaged, including decreased GI tone and motility, increased blood flow to skeletal muscles, which makes sense, relaxes smooth muscles, activates liver glycogenolysis, leads to an increase of blood glucose. So a beta 2 selective agonist could lead to increased blood sugars. So 3 medications from your med list that you had to know about were etomidate, ketamine, and propofol. These medications are used to sedate a person. So the word etomidate has that date in it. You think sedate. Ketamine, I don't have a trick for that one. Propofol is the medication that Michael Jackson overdosed on. So little fun fact there. He called it his milk, I think it was because it's white in appearance. So anyways, he was given propofol, which is a sedative commonly used when you're trying to sedate a patient pre-op or prior to intubation, things of that sort. He wasn't monitored, right, with a sedative, so it's slowing everything down. He actually ended up dying from that. So in terms of, let's say, intubation, so there's two sort of things that have to happen prior to intubating a person. They have to be sedated, and then they also have to have their muscles paralyzed so they're not fighting the ventilator. So you always want to sedate the patient prior to administering the paralytic. Otherwise, they're fully conscious and feeling their muscles not working right, and they get very panicky even though they can't express it because they've been paralyzed. So always sedate before a paralytic is administered. And the 3 anesthetic sedation medications you need to know are etomidate, ketamine, and propofol. All right, so your patient is taking a selective beta blocker, and you can recognize your selective beta blockers because you have memorized Abe and me. So you know they're starting with A, B, E, or also it could be metoprolol. So you got down, you know what they are. So the question is, you know the selective beta blocker is going to lower the blood pressure, but what else are you going to be monitoring in your patient? Well, if you got a selective beta blocker, you're going to be also monitoring heart rate, right? Prior to administering beta blockers, whether I think in the question and the exam it was selective, but regardless of being selective or not, prior to administering a beta blocker, you need to assess the heart rate in addition to blood pressure because both are going to decrease when a beta blocker is administered. Another reminder, beta blocker is going to decrease blood pressure and pulse. Beta blockers decrease blood pressure and pulse. Selective beta blockers decrease blood pressure and pulse. Just a reminder that the lab values we talked about at the beginning of the course, are lab values that you need to know going forward, not just for pharmacology, not just for exam 1, but for all your pharmacology exams and future exams in nursing, as well as your career as a nurse. So again, recognizing normal values and which organ function the lab is monitoring is something that you need to have down. So create flashcards, whatever you need to do to get those lab values, the normal ranges down. And then finally, the final exam 1 review, which medications are used to treat status epilepticus? Diazepam, lorazepam, you know they're what classification because of this ending of PAM. Hopefully you're thinking benzodiazepines. Those are usually given first, one or the other. Also used to treat status epilepticus is phenytoin, fosphenytoin, and phenobarbital. Patient may also receive midazolam or propofol for continuous seizures, but valproic acid is not a medication used to treat status epilepticus. Now we're going to look at your week 5 plan here. Chapters that you need to read and listen to the lectures are for chapter 24, anti-inflammatory drugs, chapter 25, analgesics, opioids and non-opioids, as well as out of the ATI book, chapter 45 from the ATI book, antibiotics affecting protein synthesis. From the ATI textbook also, they had to update that to say from ATI textbook chapter 49, feverfew, garlic, and ginger root are the herbs or supplements that you need to review on your own. So you got your readings to do, and then you have your recorded lectures that you can access for lecture. And then let's take a peek at your homework. Okay, so 1, homework, first assignment there, prepare for exam 2. Exam 2 will be on Monday, June 22nd at 8 a.m. We'll look at classroom assignments. Classroom assignments are going to be the same, but so you need to be preparing for your second exam. 2, ATI pain and inflammation module and tests. You want to, that's a complete and incomplete. All these homeworks are going to be due by Friday the 19th by 11:59 p.m. so that I can look at them and give you a quick review of those prior to the exam. Third assignment, chapter 24 and 25 homework that can be located under the week 5 module. That's worth 6 points if complete, correct, and on time. Again, due Friday the 19th by 11:59. Compare and contrast homework. So there's no form that I have for you to fill out or anything. What you need to do is do 2 compare and contrast. The first one is compare and contrast aspirin, ketorolac, ibuprofen, celecoxib, and acetaminophen. So what's the classification? How do they work? How are they the same? How are they different? The other one is a compare and contrast of celecoxib and allopurinol, gout medications. You can do them on the same page. Again, just type it up on a blank sheet, handwrite it, send me a picture, however you want to do it, but there'll be a drop box for you to submit the week 5 compare and contrast homework. Number 5, part 3 of last week's discussion board assignment is due by the 19th at 11:59. That's to post the correct responses to your original NCLEX questions, along with the rationale and a reference page number in the textbook.